A lot of parents, it's funny, they ask me, they say, are we ever going to be done with OT? And I say, no, I'm just kidding. Your child will eventually discharge or discontinue OT services and transition to the community. But there's some key indicators we look for. So I think oftentimes there's a false hope that develops when your child starts to get better, and maybe they've been in therapy for 6 months and they're improving, and families start thinking, or hey, they're doing a lot better, I think we should discontinue services. The only analogy I can give you with that is it's kind of like when you take an antibiotic and the doctor says, please make sure you take the full dosage. Well, you begin to feel better within the first 3 to 5 days, but the doctor will tell you, please complete the entire dosage. It's the same thing with our therapy. Your children will improve a lot, but that doesn't mean they're ready to discharge from therapy. It's really important that you coordinate, you work together with your clinician, because they are looking at things that you're not even going to be able to look at because this is their area of specialty. And a lot of times things look better, but it's a false positive. It means we're heading in the right direction, but it's not solid. And I cannot tell you, I've had 3 children return to therapy just this year because they left the beginning of last year. I think it was March, April. They were looking better, and they started collapsing. They were good for about 3 months, and when they got into school in the fall, it was a disaster. And I've had parents call me crying, upset, and even the doctors saying, I think you left therapy too soon. So really consult very closely with your therapist. We never recommend a quick transition. We drop you down from 2 times a week to 1 time a week. We will also do things like develop a home exercise program for you to do. We will help to transition you into the community. We will have your child take more control of the appointment. There is so much involved in going from a lot better to being complete. And it's the fine tuning, and sometimes that fine tuning and that cementing of that information, because what we're doing is neurologic, is very critical. So I just want you to remember that. Really, discharge should be something that we're all working together towards, and the child knows their goals, you know the goals they're working on, and we know where we're getting. A lot of times discharge, or that process of transitioning, can take 6 months to a year. So I just wanted to fill that information in, because oftentimes that's really misunderstood. It's not like, gee, I'm in therapy today and tomorrow I'm not. It makes it very disjointed for your child and also for the clinician, because they've built a bond in a relationship, and they have specific targets they're meeting. Remember, we're a medical model. We're responsible to provide progress and documentation of progress to your insurance providers. If we weren't still making progress, we would not continue to see your child, because there's no way they would even want to reimburse for that service. So make sure you're keeping up on those goal checks and progress reports, and you're working with your clinician and know how that's happening.